Welcome back to the show. You're just in time for Keeping Up with Kris. So the ancient practice of acupuncture has been around for around 3,000 years, known to treat everything from a sore muscle to high blood pressure. So I went over to Horizon Integrative Medicine and caught up with Dr. Ortega to find out what acupuncture is all about. Take a look at this video. We are here with Dr. Ortega. Thank you for being on our show.
You're welcome.
So acupuncture, everybody's talking about it, but nobody really knows what it is. So can you explain in layman's terms what exactly acupuncture is?
Sure. So, as many people know, probably acupuncture involves needles. So it's an insertion of tiny little needles. Many times they're like just the size of like the hair. They're very thin. They are not hollow, so they cause very little trauma. But the idea is to stimulate the nervous system. So we're trying to get some of the hormones, neurotransmitters to start working properly.
Okay.
Regulating the body's energy.
Okay.
And also reducing inflammation at the local area.
Okay. So I know that you said it can treat, muscle aches and things like that, but what is the full scope of things that it can treat? It can treat diseases too, right?
Correct. So we do internal medicine. So acupuncture has actually many branches, just like Western medicine. Some acupuncturists that can specialize in dermatology, some of them they can specialize in musculoskeletal pain, and others in digestive issues.
Okay. And my last question,
Yeah.
Are there any side effects?
No, usually there is no even blood involved in anything. When the needle comes out, there could be a chance of maybe like a bruise or something because there is a needle going into the body. Maybe could be like a little bit of discomfort or soreness if the needles could be too close to the nerves. Okay. But there's really no side effects in that. It's mostly benefits.
All right. Well, I'm excited to get started, so let's do it.
All right, let's go. First thing I'm going to do is manual therapy. So one of the manual therapies I use is cupping. Cupping is going to help release tension of the muscles right over the quads to go ahead and eliminate some of that pressure that might be pulling on the kneecap.
Okay.
We got some fire going.
Oh!
Let's start here. You're going to feel a little pressure there. You okay?
Oh! That is cool.
A little one here. Good.
Wow.
Same thing over here. There's different type of cups. Plastic ones as well. You can control the pressure. I like glass ones as they seems to have more stimulation.
Wow. What does the fire do exactly?
It creates a vacuum.
Oh, okay.
It takes the oxygen out and then it's just going to do the suction. In the meantime, I'm going to put some infrared therapy to stimulate the blood flow.
What?
And usually I turn off the light and you can relax a little bit.
Okay.
So usually if there is an injured tissue, you can find a cup mark. It gets very dark in color, purple. Sometimes you get like little red dots around it.
If it's an injured muscle.
Correct. Or there's a lot of toxins.
So do I have any discoloration?
Let's check it out because the red light usually doesn't help us too much. So you see this a little bit over here. It's darker compared to the other sides. So just a little bit in here closer towards the knee. Injured. Right, and there's a little bit of pain. This one doesn't have that much. So
now Dr. Ortega is about to actually perform the acupuncture procedure. So fingers crossed.
Okay, try to relax. All right.
Is it in?
Yep.
Oh.
Is that okay?
Yeah, it's not that bad.
So this one actually we're trying to go into the joint. Okay. That's it.
Okay.
So right where the cup was, this is very tight right there. Do you work out?
Yeah, not as often as I should though.
Okay. That's the last one. Oh, no more needles. And so now what I'm going to do is I'm going to do a little bit of electroacupuncture. So it's electrical stimulation to some points. Let me just hold them out like this. And it's very effective for pain. There you go. I'm going to start here and here. You're going to feel the tapping. Let me know when you feel it.
Okay. So we are halfway through the acupuncture session. As you can see, I have this needle in my forehead. But Dr. Ortega has put in all the acupuncture needles. I'm doing the infrared treatment. And so now is the part where I get to relax for about 15 minutes. So I'm going to meditate. That was his suggestion. So we'll see what happens, you guys. I feel very calm.
In your case, I would say once every week or once every 2 weeks initially.
Okay.
And then we go on the fourth visit, we do a reevaluation. We look for changes in pain intensity, pain frequency, if the activities that was causing pain, maybe they're no longer there. Sometimes the pain can move. So if it was here, it could go somewhere else.
Really?
And that will be a sign of that it was a referred type of pain. That the pain is coming from up here and not a local area.
Okay, okay.
Yeah.
It was quite an experience, but I will say 2 things. A, it works. My knee immediately felt better, like I had no problem with the knee. So I am going to keep going, but they don't tell you about the side effects. Acupuncture makes you poop.
That might be your side effect.
No, really. I thought I was tripping, and I'm like, why do I haven't even
Really?
eaten? And I Googled it, and it's one of the, because it
Relaxes your
muscles, including your digestive tract. So
I've never had that. Now, they did send me to get it done when I had my car accident. I got it done on my knees, my legs. And I don't know. I guess everyone has to try it out.
You gotta go multiple
You gotta go
times.
and I didn't. I think I went only twice.
You gotta go.
And that was it. But I've heard really good things about it.
I think this is gonna be something I'm gonna incorporate into my life. Like
Good
regular,
for
yeah,
you.
definitely. And I got the best sleep of my life.
Oh, you need to go all the time.
It helps
Sign them up.
I fell asleep on the table with all the little pins I was knocked out. It really does work.
Well, you know, it don't take you much to fall asleep there.
This is also true. But no, seriously, you guys, I know black people in acupuncture don't. Try it. I'm serious. Try it, you guys. And on that note, we got to take a short break. We'll be right back.